Good afternoon, everyone. Thank you for attending our session. Welcome. Over the next hour, we will hear some of a fantastic group of leading physicians who will share with us their experience, real-world experience, their clinical results, and you are invited, I encourage you to think about questions as we go, because I'm sure you all know that actually the best insights come from exchanging ideas between colleagues. So please do. You will be able to share your questions or via QR code that you need to scan and write it down, or you just can come to the mic after the session. We reserved like 18 minutes at the end of their talks. And please do not be shy, just ask your questions. So let's get started. Our first speaker is Dr. Fadi Hamadani. Fadi, the stage is yours.
Thank you very much. I'm going to jump right in because we have a lot to cover and not a lot of time.
Yeah, just 7 minutes?
Yes,
all right.
I will. So, welcome to the Ignite era, because this technology gives you more power, faster treatment times. There's new technologies that you can utilize within the system, and always keeping INMODE's world-renowned RF. Remember that when we treat tissue, we're not just targeting skin and we're not just targeting fat. We are targeting the framework around the fat and the skin, which is called the fibroseptal network, the anchoring complex of the tissue that, as we age, becomes thinner and longer. When we expose it to controlled heat, we are able to remodel it. It comes back thicker, shorter, with tighter skin. There are a lot of technologies on the market. I just want to compare with these two. I did an experiment where I ran the plasma-based technologies on one side and our new bipolar RF in the form of quantum on the other. And you can see something fascinating happening here. The surface temperatures remain high when you use the plasma-based technologies, but as you go deeper into the tissue, you lose a significant amount of that temperature. Whereas with the quantum technology, you're able to maintain both surface temperatures as well as the deeper temperatures, and therefore you are targeting the FSN in a deeper and more comprehensive fashion. So what is quantum then? Well, we have three ways that we can deliver radio frequency in its bipolar format. We can deliver it as a bipolar radio frequency assisted lipoplasty, the classical RFAL. We can deliver it as an external fractional RF, and we can deliver it as an internal deep fractional RF, which is the quantum. Our RFAL technologies are temperature controlled. We set specific temperatures internally and externally. We need to reach those temperatures in order to get our tissue goals. In the case of quantum, this is a minimally invasive bipolar radio frequency technology. We've eliminated the external handpiece, and the bipolar mechanism is just at the tip. So we have a lot more control over the delivery, and the learning curve is a lot easier. Bipolar RF is extremely powerful because of its incredible affinity to the fibroseptal network. The energy is being absorbed uniformly amongst the multitude of layers in the tissue. It's not just going to the surface, it's not just going to the vessels, it's not just going to the lymphatics. It's a uniform volumetric contraction of the fibroseptal network, getting a three-dimensional improvement in the tissue envelope. There are three ways that I'm utilizing this technology now in the body. If I have a patient who is planning to have a liposuction and they have thick tissue, I am now doing the BodyTite Turbo prior to my liposuction, following it up with a Quantum 25. If the patient is planning a liposuction, but she has a thin pinch, less than 7 centimeters, it's liposuction followed by Quantum 25. And if they're not planning liposuction at all, either because we have only skin that we want to contract, or we want to target specific areas of fat loss without liposuction, then I'm using the Quantum 25. And of course, this is a very versatile technology. You can also utilize it if you're planning an excisional surgery. Very, very effective and very safe as well. There, we perform the lipo, we excise, and then we deliver the Quantum 25 intraoperatively. This is an example of a type of patient with a very thick pinch, and the fat is hard, so I'm going to perform first my body tight turbo, then my liposuction, then I'm going to deliver my Quantum and my Morpheus. In this kind of scenario, in a thinner pinch with looser fat, I'm going to do my liposuction immediately, deliver my Quantum, deliver my Morpheus. When I deploy my Quantum post-liposuction, it's always the same. I have a range of 150 to 750 pulses that I deliver per 10 by 15 centimeter area. So it's very structured and mechanical for you. You don't have to think too much about it. I do one pass deep at a higher energy. I do a superficial pass at lower energy to target the skin. It's a fast treatment, and you can target also patients with just skin laxity, such as this patient here whose abdomen is quite elastotic. The medial thigh as well, you can see, is also elastotic in this patient who had liposuction previously, and you can see the back folds here that are just skin. When I am performing energy in a patient that's not going to undergo liposuction, I have specific tables based on the pinch, based on 10 by 15 centimeter zone, based on energy 15 that I can deliver. So again, very mechanistically designed for you, so you don't have to think too much, and remember to deliver the energy in multiple layers when you're not planning to perform a liposuction. And the last case is obviously non-aspirational fat loss. These are cases that we're going to perform without liposuction, and has excellent comparable results to liposuction when performed in the right patient. Remember, this is a back office procedure under local anesthesia. So this is a thick patient. I'm planning to perform my body tight first. I deliver 6 kilojoules per quadrant. Here it's a longer quadrant, so 12. And you can see that I'm delivering the energy of the body tight in a different manner because I want to induce liquefaction of the fat. When I want to induce liquefaction of the fat, I use lower temperatures and I continue to fan very quickly. When I want to do lipocoagulation, so tightening of the tissue, I use higher internal temperatures and I move slowly. Once I've done this, the fat that is extracted is the same kind of fat you get from a vaser. I've grafted this fat. You can see how beautiful and yellow it is without any blood coming. It's really, really good fat that you can then do multiple things with. Once I've done the body tight and the liposuction, then I come in and I do my dual layer approach with the Quantum 25. I deliver my pulses very slowly when I'm doing deep. I use higher energies and I cantilever my hand down versus the superficial approach where I'm moving much, much faster and delivering the energy superficially. And you can see these contractions on the table immediately. I've done one side here, not the other. If I'm planning a liposuction in a thin pinch, I'm able to deliver my Quantum immediately after the liposuction just for the skin contraction. And if I'm delivering it like in the back here, when I'm doing it just for the skin, I'm doing deep passes, superficial passes, go faster in order to get the contraction. These are some of the results that we've consistently gotten, and you can see how the results continue to improve over time. This was without liposuction at 4 months because she didn't want any lipo. This was without liposuction as well, so you can see the power of the technology when it's performed in the clinic. And in addition to this, we have the Evolve to Transform, namely, which is EMS and controlled RF. It's an excellent both neoadjuvant and adjuvant approach after your liposuctions to ensure, maintain your inch loss as well as your skin quality. When you apply it, you can get fantastic results even in elastotic skin, results that we haven't been able to achieve with any other technology. My last slide, energy is a dial. It's not a limit. It doesn't mean that more energy is better results. It doesn't mean that less energy is better results. The energy gives you a spectrum of what you can accomplish depending on the depth you want to reach and depending on how you deliver that energy. Thank you for listening.
Thank you very much, Dr. Fadi. Our next speaker is Professor Aozi, Inside-Out Tightening, the radiofrequency revolution in lower face, jawline, and submental sculpting. Please, Dr. Artzi.
So it's always great to be in my second home in Bangkok. And I do have to say that with these patients, for me as a dermatologist, this is a challenge to treat it non-surgically. So I don't know what happened. All right. So I hope the other photos are okay. But I think if you look at patients with like sagging of this area, I had quite a journey in my career. So for sure, liposuction, this is kind of the first treatment. I have to say lasers provided me with very subtle results. And then I moved to face tight. I even published the first publication of face tight, but I do have to say that I felt as if I really boiling the skin. Then I moved to J plasma, and I had one case in which I had retrobulbar kind of gas accumulation, and this patient was hospitalized, and I freaked out. Everyone freaked out, by the way. Everything is okay. And then the FDA came with this warm warning, and I said I do not want to, I want to sleep at night. And then when the Quantum RF came into the market, I was very happy because of the very, I would say, precise, reproducible result. It means that I know exactly how many pulses I should deliver in order to really achieve good result. Now, soon we're going to publish this paper. This is a work, two plastic surgeons and myself, in which we kind of tried, this is the beginning. By the way, from this work, we kind of know more, so we know how to play better with our patients. For example, even Fadi, I saw now his techniques, and every time we're getting more and more advanced. And just today is going to be the session of 4:30, because in this session of 7 minutes, I will not be able to really get into the details, so I'm going to share all details of how to perform the tumescent anesthesia and how we did it and what was the aspirate. But here I want to share with you the result. I'll start by saying this is one of the most impressive results that I've seen with a device, with an injectable device, the injectable, I would say, energy that is getting into the tissue. Just for you to understand, so if this is the score, you see 0, this is a baby, defined jawline, no submentum. 4, they're in an extreme submental fat. So whenever you look, and it's 3 non-involved physicians, we evaluated 33 patients from 3 different settings in different countries. So you can see, we see 60.9 decrease in submental fat. Just for you to see the evaluation of the patient themselves. They use the same scale, so they got the before and after, they got the scale, quite the same result. While talking about what we say skin laxity, which this is, I think, this is the drawback of just liposuction. If you do just liposuction, you do not really treat the laxity. So in this scale, we talk about 1 to 9 range, again, nearly 40% reduction of skin laxity. One thing that I was really, I have to say, surprised, women, probably men as well, but women are highly disturbed by this area. So there is a psychological score to evaluate how they take the picture, which clothes they wear in order. So there was nearly 50% reduction in the score, and the satisfaction, as you can see, very, very high. If we get into the adverse reaction, bruises, for me, it's not an adverse reaction. Whenever you subcise and you do liposuction, nearly all patients develop some degree of bruises. So this is nearly 60%, but you see no severe adverse reaction. So this is my patient. You can see the before and after, and I'm sure you can appreciate the very good result. This is in a male patient. Again, dramatic result. This is a young patient in which usually in the past we tried everything. So the first modality, the first step probably will be quantum RF, and you can see the very dramatic result. This is by the beautiful Fadi. You see, have a look at the jawline and have a look at the contour of the submental neck. This is after 1.5 months, and this is after 3 months. Again, this is baseline and 9 months. You can see the result, and this is from the Bulgarian side by Evgeny. You can see very good result. What we have learned, to summarize from this very, I would say, initial study. One, that if you combine between Quantum RF and Morpheus, we call it inside, outside, like sushi, inside out tightening. We have dramatic result. The second one, you have to be patient. It takes time, up to 9 months. And the third one, that you have a beautiful neck-face interface, or new interface. It doesn't compete with any other modality. Again, I do not know what happened to the pictures, but have a look. For example, this patient, this is after 9 months. Again, this is after 9 months. So you can see the inside tightening of the device. You can see her from a different angle. This is a young patient. This is how we see her at suture removal. So you still see the suture. This is a week after procedure. Again, a week after procedure. This is at 9 months. Again, before, again, suture removal. And have a look at the dramatic result. 9 months, it takes time. And the last case, if we talk about the face-neck interface and the jawline reconstruction, you know, you see lots of fillers here. Fillers change the lower face. So nowadays, if you really want to maximize the result and to maintain natural result, have a look at the change. This is only the removal of xanthoma, xanthelasma, and quantum RF. You can see the dramatic change, and the last patient, dramatic result. Thank you so much.
Thank you very much, Ophir. Our next speaker is Dr. Fotini. Morpheus 8, the pillar treatment addressing medical and aesthetic indication in the same session.
Thank you so much. So I'm really happy that I'm here talking about my beloved device, my baby. So it holds a very special place in the clinic. Okay, so those who are like many devices in the clinics and use modalities and like inject and use lasers, the mentality is to combine. But combining means 1 + 1 = 3. Because if 1 + 1 = 2, why to combine? You increase the potential complications, the cost of the treatment, without a practical gain. So, and what combining means combining different modalities. With Morpheus 8, we have a combination of 3 different things in one device. And we're talking about radiofrequency, microneedling in a fractional mode. So we have a fractional RF device with bipolar radiofrequency with different modalities, different modes, multiple depths, different kind of thermal effect on different depths, and collagen remodeling, skin tightening. So the technology behind is known for decades, and I'm not going to get into depth. What is important is to think that we are talking about proven effects of collagen stimulation, of skin tightening, and this is something that is published, and we have many patients that prove what we are talking about. The important thing is, and this is what I'm going to share with you, that you can treat usually with the devices we are treating cosmetic indications. With Morpheus, we can also treat medical indications or borderline indications, and this is what we're going to see in this case that I'm going to present to you. So our patient for today is 32-year-old female, phototype 2 to 3, with a negative personal history of pretty much everything, no medication. She was treated for acne from her gynecologist for some reason, deeply depressed, okay? So she came to us what we can see here, it is acne vulgaris, acne scars, and a very sad face. So at that time, we were early with the Morphos, and I wasn't really, confident that this device can help her. But she had tried pretty much everything. So I said, let's treat her with that and see what we can gain. And this is also her concern about skin laxity. So she told me that, I told her, do you want to be injected? Or said, yes, but I have like this acne and it's severely depressing me, and I don't want to get into aesthetic treatments until I finish with acne. So we have acne vulgaris, we have acne scars, and then we have skin laxity issues. And this is her after. And at that time, we wouldn't focus on the skin laxity issues. We were only focused on the acne. But 6 months later, we have controlled acne vulgaris, we have minimum or no acne scar in certain areas, and we have an impressive improvement of skin laxity. And this is a real patient. These are patients that come in the clinic every day, okay? So she's around her 30s, she wants to, she's very active, she wants to date, and she has a bunch of problems that when they need many different treatments, a big budget, usually to be treated. So you can see here how clearly the device has worked on this patient, both sides, and you can see how happy she looks now. So this is the treatment protocol. First of all, we concentrated on the active acne vulgaris lesions. So with the Morphos 8, you have certain protocols that can work on the active lesions. So you can go on the inflamed lesions and you can work with the device. These are my parameters. You don't need to be aggressive on the whole face. You just treat with these parameters the inflamed lesions. And then acne scars and skin laxity. So these are fixed mode on the areas that are more scarred and the cycle mode on the whole face. And you can see exactly what we used in this patient. So how many treatments we did? We did 5 sessions, and as Ophir said before, we need time, okay? We're not promising here that they can see the difference like next day, we need time. 6 to 8 weeks intervals with a downtime that is minimum for fractional RF, like 2-4 days. I'm practicing in Greece and I'm doing like this very sunny 11 months around the year. So if the patient is a little bit sensitive with the sunscreen, it's a device we are practicing even like in late July or early August, not late August because we're closed. So post-treatment care, healing cream, whatever works better for you, sunscreen, and especially tinting sunscreen. If you don't want to get PIH, please train your patients to use tinted sunscreen, gentle moisturizing cleanser. Why this is very important, and I know that maybe you have many devices in the clinic, and I have one of the most equipped clinic in Athens, because with one single device, you address 3 different indications: medical, aesthetic, and borderline, okay? It is very time-saving for the patient and for the clinic in case your appointments are like long, like hours, and it's very cost-effective. It's a treatment that is not cheap, but at the end of the day, when compared to 1 million microneedling sessions or other treatments that do not work, time is money, so people are happy. It's applicable to filler-phobic patients, and you know that recently people do not want to be injected, blah, 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 so it's a device and they feel more friendly. And something very important, we're touching areas of the body that we cannot touch with anything else. I'm performing deep chemical phenol croton oil pills, but I have to stop in the mandibular line. So if I want something for the body, I have Morphos. And we have a minimum downtime, as I said, which is very significant for the patients and for us in order to sleep well. No, it's okay. That's it. If you want to learn more about our device and scars, I invite you next May in Athens. Ophir Arzi is the boss, and I'm helping him to kick a very nice meeting. Thank you so much.
Thank you. Thank you, Dr. Fotini. Our next speaker is Dr. Van Arvie. The 6-week jawline reset, the 3-step submental sculpting protocol with Optimus Max.
Wow, the podium is very high. I'm quite scared, actually. I might fall. Okay. Good afternoon, everyone. Can see everyone right here, and I hope you can all see me as well. Actually, I saw amazing results with Ophir and Fadi, and oh my God, it's amazing. But I mean, my patients, I'm a dermatologic surgeon, but a lot of my patients, they want something very non-surgical, non-invasive, less pain as possible, no downtime, but obvious results and good results and fast, please. So, you know, I loved your results, but I've got something to deliver to my patients as well. So this is how I do it. It takes about 6 weeks. And for me, I love how I could use Optimus Max in different hand pieces. It can target in different layers. It's not just one layer, but multiple layers. Because with submental fat, it's not just the fat alone. It's all about the tightening as well, because other machines that we have, for example, with cryolysis, it can actually melt the fat, but then you get that loosening of the skin as well. So just single treatment with a single layer, it wouldn't help. So for me, I thought, right, this is it. I found the thing that can actually help my patients that target all layers and create great results within 6 weeks. So how did I do it? The first week and the third week, I melt the fat first. I use Mini FX to melt the fat, and of course using this Mini FX, which Paul's going to tell you all about it. It's an amazing handpiece that causes the fat to melt, and then on the third week, I actually redo it again. It takes about 2 weeks for everything to repair, for our skin to go through phases to reduce the inflammation, just right enough for our body to clear. And then on the 5th week, then I use Morpheus and Lumeka to give the patients a little bit of the glow and also with the tightening as well. I mean, with my patients, they want something that is very fast. For liposuction, it may take about a couple of months to take place, but for this, it's very fast. But first of all, why my patient loves it is because of Lumeka. It's brightening. Within a couple of days, the patient will say, "Oh, that's a brightening of our skin. Okay, that's good enough because I could see something." And then once the fat started to lose, everything started to tighten, they'll love the results. So first week and the third week, I do the debulking and prime the skin first with MiniFX and Forma. It doesn't take long. It takes about 45 minutes to about an hour per session. And then on the third week, I redo it again. And then on the 5th week, I do Lumeka first to just give a little glow. And then touch up with Morpheus 8 to tighten all those fibroseptal network, to tighten the skin, as well as do a little bit of the resurfacing. You can create that nice texture on the skin as well. You've got everything from melting the fat, tightening the skin, thickening the dermis, as well as resurface the skin, and also create that nice glow at the end, the cherry on top. So, first of all, it's very important to treat the patient that is the right candidate, because if you don't pick the right candidate, there's no point, right? For me, it's good for patients with mild and moderate submental fat only, okay? So let's see, this young lady is only 25 years old, but you could see that her face is not very well defined, and she could see that fat. But can you see this? This is only 2 weeks. Only 2 weeks, it's not too bad, isn't it? You can actually reduce the volume of 7.5 ml. And by 1 month, amazing, 10 ml is actually gone. So this is pretty fast, isn't it? 1 month. I mean, this is not like something short surgical, but this is amazing. I think my patients are very happy. If I don't have to go through the downtime and the surgery 1 month with this, I want to do it again as fast as I can, please. This is what my patient's going to tell me. So this is how I do with MiniFX and Forma on the first week, and then wait for 2 weeks, and then do again at the third week, and then wait for another 2 weeks again, do the last step of Lumeka, and then with Morpheus 8. I think one thing about Lumeka is that a lot of us are quite scared about how powerful Lumeka can be. It is powerful, but you shouldn't be scared about it because it's amazing, especially with a 580 nanometer and how it has that long length. It's very good for patients with skin like us, with darker skin type, because it won't burn, but then it will create a really fast result, faster than other IPL. And at the same time, now with Morpheus 8, we have the burst mode, which saves a lot of time and just as effective. And also we have a scale mode where it goes at different depth at the same time, but then it reduces the energy as it goes up, which is great for us with skin type, darker skin type, because we are prone to PIH. So with scale mode, it helps us to save the time because it hits at different level at the same time, but reduces the energy as it go up. So reduces the risk of PIH, which is one of the most concerns in a lot of doctors when using Morpheus 8. So you could see now on her side, another 7 ml. That's a lot. I mean, I wanted to sell her some fillers, but I guess she doesn't need any more. So what's the pearl to this great result of 3-step jawline transformation? First of all, the patient selection is very important. Make sure that the patient is only mild to moderate submental fat, okay? Not too much, good skin quality, not too saggy, okay? 2, hit the multi-layering. Be sure to use all the hand pieces that you need, because don't treat just the layers, but treat all of them, address all of them. And then 3, it's all about sequencing. If you know it, hit from down below, debulk the fat first, and then go upwards to just tighten the fibroseptal network, tighten everything, locked everything in, and then give a little polish with the Lumeka. Perfect. That's it. It's fast, it's comfort, less pain, amazing results in just 6 weeks. I hope you would try that next time and then let me know how it goes. Thank you very much.
Thank you very much. Thank you. Amazing. Our next speaker, Dr. Joe. Foundation First, a real-world series of 80 cases on skin quality improvement with Lumeka Peak.
Hello, everyone. Okay. All right. Okay, sorry for the delay. Okay, hello, everyone. I'm Dr. Cho. I'm sure that everyone in this room, after listening to the previous talks today, we all feel very inspired because the device becomes smarter. The results are faster, and every year, our aesthetics become more advanced than the year before. While innovation continues to move our field forward, today I would like to talk about something more fundamental. Because no matter how advanced aesthetic becomes, healthy skin still begins with foundation itself. And one technology that quite remained for the foundation all along is IPL. Not because it is the newest technology in this room, but because it continues to move the things that matter most in our practice, such as evenness, pigmentation, and overall skin quality. I don't see IPL as a trend. I see it as an infrastructure. think of it as a daily vitamin. You don't feel it working immediately. Think of it as a primer beneath makeup. Any gentlemen in this room know what primer is? It's beneath the makeup, invisible in the mirror. But the reason the finish holds. So for me, IPL is a quiet baseline beneath everything else we do. This is how I built a program and how I teach my team to build one. First, the foundation. We begin with IPL cycle to normalize the skin, strengthen the barrier, and quiet chronic inflammation. Then comes the focus. Once the skin foundation is healthier, we layered in the targeted treatment, and every advanced treatment tend to perform better, less outcome, and less complication and cleaner outcomes. Last, the maintenance. Sure, because every good skin is not something we create temporarily, but it is something we continuously maintain. Today, I will present 72 cases built on this exact philosophy. I created my own study at my own clinic by using Lumega Peak to the entire face. At Energy 5 June, 2 to 3 passes 4 times every 4 weeks. The results were analyzed by 3D quantifier at 2, 4, 6, 8, and 10 weeks after the procedure. 59 cases were female, 13 cases were male. 9 subjects were skin type 2, 41 subjects were skin type 3, and 22 subjects were skin type 4. After 6 weeks, we saw significant improvement in the skin evenness, pore appearance, and facial oiliness. However, the changes in brown spots and redness did not reach the statistical significance. The study is still ongoing, and I'm looking forward to present the last 10 weeks results in the future. Let's start with the evenness factor first. After only 2 times of IPL treatment, at 6-week mark, there are already evident improvement. Out of 72 cases, here are some examples. A 42-year-old female with skin type 3, and case B, 25-year-old female with skin type 2. Case C, 27 male with skin type 3. Next, the pause factor. After 2 IPL treatment, even pore have already improved. As you can see in this case, such as case A, age 31 with skin type 4, case B, age 35 with skin type 2, and case C, age 27 with skin type 3. In addition, the oiliness factor. There is an already obvious change in the skin's oiliness, such as case A, age 33 with skin type 4, case B, age 25 with skin type 2, and case C, age 39 with skin type 2. Furthermore, the brown spots, although less significant, the changes are still noteworthy, such as this case, case A, with skin type 4, the brown spots were reduced by 1.8%. Next case, case B, with skin type 4, her brown spots were reduced by 3.7%. And last case, this case has skin type 4, her brown spots were reduced by 2.2%. Lastly, the redness. We observed that the reduce of the redness decreased across the patients. Both cheeks appear less inflamed. As you can see, by using IPL, the obvious reduction of the redness decreased to the patients. So you might notice that every patient have different concerns, such as redness, evenness, pore, sensitivity, or post-inflammatory changes. Despite different changes, different diagnoses, once the foundation improves, many of them share a similar journey. The skin became calmer, the recovery became smoother, and subsequent treatment often perform more consistently. So, my message today is simple. Technology changes, but the foundation remains. Thank you.
Thank you very much, Dr. Joe. Our next speaker is Dr. Paul, from photomechanical disruption to thermal remodeling, case-based insight into picosecond laser and radiofrequency applications.
Thank you, Ron. Lucky last. I have to talk about two technologies, so I only got 7 minutes, so I kept it 10 slides. Okay, so Optimus Max has everything in it. Everyone talked about Morpheus8, Lumeka, and the whole lot former. I'll be talking about my baby, which is MiniFX. Now, as Dr. Kwan mentioned, my clients over the last 23 years, which I've been working, want quick result, instant result, and long-lasting result without downtime and without pain. Now, in the past, with the old MiniFX handpiece, I think we've been misusing it. And when I was young, I thought higher energy, higher temperature gets better result, but that's not the truth. Now I can achieve all of that without it, less pain than monopolar, no downtime, instant result without having any downtime. Now, so the MiniFX Pro is much lighter. It's got that first RF, which gives a bulk heating in between two bipolar plates. Now, it's a bipolar energy. Everyone thinks it's very superficial. Now, INMODE has gotten over that hurdle by creating a MiniFX, which sucks the whole tissue in, and very strong energy passes between that plates. And we can achieve deep contouring result with fat loss or without the fat loss. In the past, we've been just concentrating on losing fat, but this is not it. Okay, so we can achieve, it's adjustable settings, and the new handpiece allow us to achieve contouring and tightening result with fat loss with very short amount of time. I'll go through that. Now, I'm going to show you 3 cases, all interesting, all different cases. Now, this lady is a Thai client. I have a lot of Thai clients in Sydney. I did reverse vector, ponytail lift, thread lifting with the collagen stimulator first. And when she came back, she still was very heavy on the lower face. So this is the instant result that I could achieve with the MiniFX, just maybe 3 to 5 minutes per side. And as you can see, MiniFX doesn't give you bruising or long-lasting red marks anymore. It was the way we used to do it, everything changed. As long as you put the tissue into that 2 bipolar plates in that cup, we can achieve no pain, instant result, and long-lasting result like that instantly, okay? Now, if you look at the settings, they're all low. Power is 20. The maximum is 40, 45. And I use low setting, low cutoff temperature. That 41 is the surface temperature. So internal temperature, I'm not quite too sure, but it is very high. So it's all about how you cook it well. As Fadi mentioned, it's not all about high temperature or high energy setting. You have to get the right sequence. If you know the right sequence and how to cook it well, you get great contouring and tightening result at the same time. Now, this is instant result, and that redness only lasts about 10 to 20 minutes. And people go home I do it without numbing cream. As you can see, significant neck tightening result. Also, the jowl, which was her main concern. All I did was 60 passes of well-executed MiniFX shots, not 600 to 900 shots of monopolar. Even if you do 900 shots of monopolar RF, you're not going to achieve this result. Deep contouring result with fat loss, and some area where you don't want the fat loss, we do that. So only small, well-executed MiniFX shot is required. Now, this is another interesting case. She actually went to Turkey and got a fat transfer done, but she wanted to have a fat transfer whole lower face, but the surgeon did a fat transfer only in the mid-cheek. So she hated it, and she also asked me to tighten it. So she asked me to get rid of the fat and tighten her face at the same time. Now, I did mini FX, same protocol, and this was the result that I could achieve within a month. So she actually got that 90% of result instantly on the spot as I was treating it. And when she came back 1 month later, she got what she wanted, reduced in the fat transferred area. It actually remodeled that fat transferred area really nicely. And if you look at the second lateral picture, very nice tightened jowl area as well. Now, this is just a normal case that I do every day. She came in, she wanted to reduce the fat on the submental and tighten all her lower face without losing the fat. So it only took me 10 to 15 minutes to finish the treatment. As you can see, the second picture is straight after. That redness, that pink even redness, without the bruising, without the severe red marks that we used to create with high settings and poorly executed mini FX shots, it's a word of past now. We don't do that anymore. So I achieved that result instantly within 20 minutes. And then I was able to get the last picture last week because I only did her 2 months ago. And before I came here, I was able to get the 1 month result. So followed by long-term result. It's not just a short-term result. Okay? So what we see here is just one session of really well-executed mini FX. I can achieve this day in and out for every single client. Okay? So this is a perfect example where what mini FX can do in your clinic, which none of the other devices that I know which exist in the earth can do. My clients are so happy, and this gives you long-term result and without downtime. That redness only 20 to 30 minutes. Now, picofy. So I'm going to give you very, I know I've been using picosecond laser for the last 10 years, and then I've changed few in the past, and then I'll tell you how you choose your picosecond laser. Now, I think 1064 and 532 is all you need is to treat every single possible indication, and this is very safe for darker skin type. Lumeka, type 1, type 2, up to type 3, great result. I use Lumeka on my Optimus Max. Now with the addition of picofy, I can treat basically every single indication. But what stands picosecond laser more than the Q-switch and the AG laser, nanosecond laser, is its ability to treat darker skin type with less downtime and very safely. But my clients, what they look for is not just the dermal pigment result, not just the PIH, not just the melasma result. It's the non-ablative skin resurfacing result that my clients continue to do the picosecond laser. Sorry. Sorry, I'll just conclude. So when I choose, I use how homogeneous the top hat beam is. So picofy has the most homogeneous hat beam. So we can just do less pass to achieve the same result. And then 10 hertz, I can get homogeneous result like that. Just to how powerful it is. Seborrheic one session I got rid of it. At the same time, I was able to achieve a lot of mattifying result, non-surface resurfacing result. That's the rebound melasma. One session, very low setting. So with picosecond laser, the most important thing is slow and low, which picofy is the most in strength for. PIH case also one session, very slow and low. Pigmented, soft, early scars, I can achieve that result with one session. And these are all a recurring pattern when I treat my with the picofy lasers for all across the patient ranges. Sorry, I still ran over time.
Thank you very much. Thank you, Dr. Paul. So, we don't have so much time left as we actually expected. However, now it's your turn, so I would really invite you to address any comments, questions, doubts, or anything. So if Anyone, you are invited to come to the microphone. Do we have questions? Please, go ahead. Okay.
Question for Dr. Joe. Hi, Dr. Joe. I'm Sherry from Australia. I'm very impressed with your presentation, and this is my first time seeing at 5 lowest setting of Lumeka and deliver amazing result. So my question is, why you keep it at 5 and not higher? And yeah, will you just maintain at 5 forever for every patient?
No, actually, in the real practice, I customize the tunes for my patients. But since this is the study, so I want to share that if we just use only the minimum tunes, minimum energy from this IPL with different types of skin, right? How it's going to be, because the 5 tunes is very safe for skin type 4 and especially skin type 5, and it will not cause burn epidermal. Right.
Okay, thank you.
You're welcome.
Okay. Someone?
Hello, I'm Dr. Shinjinora from Japan. I have a question for Dr. Offer and Patty. Thank you for sharing great cases of quantum 25. Is there any concern for burn case? Because probably you use some anesthesia when you use quantum 25. So would like, if you have any tip to avoid a burn or
Burns?
something? Yeah.
I didn't have any case of burn. Again, if you keep on doing another burst and another pulse in the same area, probably you will have burn. However, there is a monitoring of the temperature inside the cannula, and then when you get a certain temperature, it doesn't allow you to continue. So it's like it's getting stuck. Really, I didn't have, as compared to, let's say, other devices from INMODE and from other companies in which I had some issues, I didn't have any case so far, touch wood, of marginal mandibular paresthesia. I didn't have any case of burn, really. So it's highly safe in my hand.
That's because I trained you. No, I'm just kidding.
Okay.
Just joking.
Thank you.
Here that are safe, so don't
I did nothing. I went to the clinic and he was doing everything. I didn't even have to say anything. I just left. I drank coffee and left. He's a master, really. But no, I mean, look, any energy-based device is heat at the end of the day, and any heat delivered inappropriately will lead to a burn. The biggest culprit in energy-based devices is the laser, because it's not circuited. Quantum is an impedance-controlled device. It will only fire if it has very good contact. It's very high temperature, but very, very low pulse duration. So you're quite safe as long as you, like Ophir said, you don't go nuts. So control the depth. This is really important. Deliver the energy in a retrograde fashion. And you can stack, but you need to do it deep. Closer to the skin, lower energy. It's all about knowing how to control the energy. And I haven't had I've had epidermolysis, which is a sloughing of the skin early in my days, but I haven't had any problems since.
Okay, thank you.
Okay. We have a question for Dr. Fontini. Has Morpheus 8 become a standalone treatment in your clinic, or is it increasingly part of combination protocols?
You meaning probably about acne or in general? I'm going to cover both.
Yeah.
So first of all, I'm a dermatology. I don't treat patients with acne with Morpheus. But when we have resistant cases, when we have cases that cannot get under isotretinoin, or they have done everything and they don't react, or they have other issues, then I try always to incorporate Morpheus 8 in my treatment. And then we have some patients, I'm sure you all have, that have some active acne lesions but want to treat the acne scars. This is the only way you can touch them. Because if you do like fractional CO2 laser, and you're going to apply creams and healing creams and everything, you cannot have good results. So you cannot control the inflammation. You're controlling the acne scars, but then the inflamed lesions give you new scars, and then this is like a vicious, a circle, and the patient pays more. So for those patients, it is in my hands is the only thing you can do to address acne vulgaris and acne scars at the same time. Now for aesthetics, it is like Coca-Cola. It goes with everything. So I inject biostimulators, HA, toxins. I always, even if they're young or if they're young, I tell them you have to take care of your neck, for example, and be proactive. If they have the indication, of course, then we go full protocol.
Can I add one
Yes,
thing?
of course, of course.
I think it became an essential, you know, I have my own private clinic and a big hospital-based setting. It became one of the essential tools that we have in my private setting and in the hospital. In the hospital, for acne, for hidradenitis suppurativa, we published on it with or without oral medications. So we use it with other isotretinoin in acne patient, or with doxycycline or minocycline. In hidradenitis, we use it as a monotherapy or with biologics. So it became an essential tool for medical indications, and for aesthetic, for sure. We use it in all combinations possible for different indications. So face, neck, body. We didn't talk about stria. You know, it's a session that you cannot really cover everything, but it became really either as a monotherapy or as a combined approach. This is really, if you're a dermatologist, this is a device that you should have.
Anyone else want to add something?
I had a comment actually about the mini effects. First, amazing. Second, I want the handpiece because I want to try it.
We will.
Third,
We will.
I want to be the devil advocate. You showed result after a month and after 6 weeks. As I just look young, but I'm quite old. You know, even if you do liposuction or if I do quant, it takes time. So I'm trying to think, maybe it's false results. Maybe it's just a contraction of the fibroseptal network, and then in the end, you won't have the result. So first, we have to see the long-term result. This is one. Second, I think we have to challenge ourselves, maybe to do because what I do now, we do quantum, and in order to hasten the result, I use actually HIFU, because they don't want to go through Morpheus. I always say the truth. But maybe if we have the mini effects, so to do, maybe it will hasten the results. So this is an idea that should be investigated.
That sounds reasonable, Ophir. We can consider it, I'm sure, because we do have, and Dr. Paul Hahn really does a lot of cases and shows amazing
but
results.
Again, I want 6 to 9 months follow-up.
Okay, we'll try to manage this. Yeah, I would like just one last question for all of you, because taking what energy as a dial, okay, this is a concept that is becoming so relevant in terms of longevity and regenerative medicine. How do you experience your everyday practice in terms of energy delivering? Do you really think that, let's say, mastering the energy, moderating it, really influence the outcome and the clinical in terms of regenerative medicine and long-term effect? This is something very interesting, and I think it applies to all technologies. So this comment on this would be, I would appreciate from all of you, please.
I will tell you something from my experience. First of all, the companies have great devices. They don't know how to train the doctors. So this is very important. When I first got the device, I thought that the more the energy, the better the results. Then, while studying the studies, and then I appreciated the bulk heating. So you don't need to be very aggressive. You need more time, the tissue to be heated. So this is something that nobody trains. That's why those people are here. So first of all, we need to know the device, and we need to know how it works, and we need to know the correct parameters. So if you don't have good results, for example, with Morpheus, you don't know how to use it. And I'm really, really honest with you. I paid it, I have bought it, okay? So they didn't give it for free. So really, yes. It happened to me at the beginning. I bought it because it was fun and it was everywhere on social media. I didn't see any result from the one treatment. But then when I worked a lot with it, and I'm the first clinic in Greece by far, now I tell them, no. When they come in the clinic, they said, I did it before, I said, okay, I will do it, you will pay, and if you don't see results, I'll give you the money back. Not a single case. So energy, you have to know how to manipulate, and you have to know what your device can do. It's like owning a Ferrari, going only to the supermarket, okay?
Okay.
Yeah.
Maybe we can hand to... Okay, go ahead.
It's a complicated question because in the end, it's two extreme: regeneration on the one side and fibrosis on the other side.
Exactly.
And these two extremes, and we study a lot of how to get to either regenerative or regeneration or fibrosis. If you go too, I would say, deep, too frequent, let's say you don't keep fractional, so untreated area. If you go too much, too high temperature, you have to understand that in the end there is a huge difference between if you use, for example, 5 joule again as compared to 11 joule. If you do 5 joule several passes as compared to one pass with a very high temperature, so everything is different. In the end, in order to really have a regenerative capability, you don't have to go high. You actually have to go low to moderate. So if you want to destruct, okay, destruction is something else, all right? And we want to destruct fat, for example, either with the fixed mode and the very high setting, for example, with hidradenitis, or with the quantum when we talk about fat. But whenever we want to be regenerative, go low. And actually, it applies when we talk about inflammation. So when we talk about the anti-inflammatory properties of, for example, Morpheus, in the past, I used to go very high. It's a mistake. Nowadays, the more I use it, I really reduce my setting to, if I go, let's say, 2 millimeter, 12, 13, 15. In the past,
Yeah,
I used to.
I really appreciate
This is not actually. So you have to, you know, it's a curving, it's a learning curve
Absolutely.
in the end.
Yeah.
But again, if we talk about anti-inflammation and regeneration, go low, go low.
Especially
Okay.
certain areas,
Okay.
like around the eyes.
Yeah.
Could, yeah, please.
Yeah, I think we were quite scared about using Morpheus 8, especially with us with a darkened skin type. I think a lot of patients came in and see me and said, I don't want Morpheus 8 because I had really bad PAH before. And a lot of doctors even come to see me and said that, you know, I don't really got good results and I got lots of PAH. So I start asking, so what energy were you using? And they were using quite high energy, but then just one pass. I was like, how about, you know, you just reduce the amount of energy and you could do multiple passes too, or you could do stacking. You know, there are different ways that you could do it, but you don't need to go all the way so harsh. It's like breaking it instead of just, you know, rubbing it in. So I think, you know, it's all different. It's a great machine, but you just have to know how to use it properly.
I'm very glad to hear that. Yes.
It took me 7 years to know this. Yeah, it's a hard learning curve. When I first was using MiniFX, everyone it was a big hype in Korea. So in Korea, there's like 3,500 units sold of that MiniFX. But it gave me, what gave MiniFX a bad name was that severe bruising, red marks, which we didn't have to give. And it took me 7 years to realize that, and now I'm doing low energy, low temperature, basically no pain, basically, and no downtime. And yeah, it took me a while, but you know, I learned, and you guys don't have to go through that.
That's important. Dr. Joe.
For me, it took around 7.5 years. Sorry, kidding.
Similar.
Right. Oh. I didn't notice that.
Yeah.
Right, so I think, as I mentioned earlier, that technology are becoming more advanced every year. But for me, I think technology alone is not enough. The real value for my work, for my philosophy, is three things. When I want to decide which energy I want to use or which machine I want to treat for my patients, is first is about judgment. Second is restraint, like Ophi said or Hans said that, Paul said that. It's all about learning curve. And the last important thing is you have to understanding the individual phase of your patients. These three philosophy is the most important than technologies.
Thank you. Thank you so much, Dr. Fadi.
Yes, sir. I'll take ownership of the dial analogy because I came up with it from my own experience. And it all comes from an equation that I always have in my head. And I'd like all of you to remember this equation. Power equals energy multiplied by time. I'm going to say it again. Power equals energy multiplied by time. The effect in the tissue is very different if you deliver very high energy over a short period of time. So I can deliver energy of 10 over 1 second. I'll have a power of 10. But I can deliver an energy of 1 over 10 seconds. I'll still have a power of 10. But the effect on the tissue is massively different. And I do believe in high energy in the right depth. And in the body, it's very important, more so than in the face. But again, it's right depth, and it's how you deliver it, and not all energy is created equal. Bipolar RF, I showed the video. It has a fantastic affinity for the fibroseptal network. This is a 3-dimensional framework that we lose as we age. In fact, I'm very honored to work closely with Diane Duncan, who is a real pioneer in ECM analysis using scanning electron microscopes and proteomic analysis. And she shows in her pictures, gorgeous scanning electron microscopy pictures, how the framework, the extracellular matrix, disappears with age. It's no longer there to support the fat, which elongates. And so everything I showed you in that parachute picture. Well, we're discerning now more and more experimentally and have the evidence finally for what we see clinically, which is lower energy in the fibroseptal network, in that extracellular matrix, as Ophir said, leads to more anti-inflammatory cytokines and a more remodeling environment and milieu in order to get contraction. And when you use higher energy, you're more destructive of the FSN and you create a more pro-inflammatory wound injury kind of response. So the dial is knowing how to control the energy, but it's not the end of the story. It's also your depth. And most mistakes happen not because of the technology, because of patient selection, wrong depth, wrong energy at that depth. So it's a huge learning curve. I'm still learning. I think we all are. Iran is a master of Morpheus. I learned a lot from him in Morpheus, and he's still learning because it's a fascinating world that really lies at the intersection of biomechanics, immunology, physics. It's all there. So, and I love this technology because of the incredible variety and massive applications that I can have, both as a plastic surgeon and an aesthetic doctor, because my clinic does both. So that's what I would say. Thank you.
Thank you so much. I really would like to thank you all for this participation. Thank you. Take a photo.